Subject vitamin minerals. Fat salt vitamins A, D, E, K. Water salt vitamin B complex. Principal elements calcium, potassium, magnesium, sodium, Ca. Yes. Track element followed food. PMR, RQ, STA. Balanced diet. Magnesium, catch sugar core. Vitamins help with the body function effectively. Two types water soluble, fat soluble. Water soluble B complex, complex and B and C. So vitamins come by food essential contributor to vitamin D. Need or course take supplements to provide extra vitamins. Absorb fats soluble vitamin B patient with higher fat. The function of storage of blood and the body have been separation as much too little. Fat soluble vitamins are vitamin A, D, K, present with contained fat. The absorbed vitamins that they do fat that do not dissolve in water. Vitamin A, there are from the involved in the body retinol. Retinol is retinoic acid collected to the colored vitamin help in better source of healthy vision. Without a vitamin A, person is trapped with vision problem. The partial vision loss. Beta carotene is the pro-vitamins of the vitamin A. Vitamin is present in the vegetable contains a yellow pigment called carotene. Function of vitamins. Essential to abnormal rotation with normal function in the retinal for clear vision in dim light. The protein synthesis essential differentiates support growth and reproduction. Antioxidant source of vitamin C. Functions source of body include the vision immune system. Source of vitamins: butter, cheese, egg, milk and curd. Source of beta carotene: green leaf vegetable, mango, carrot, jackfruit. Deficiency of symptoms: deficiency causes nutrient blindness, night blindness, eyeball loss, which is apparent result is dryness of eye. There is mutilate triangular page, by spot. Inflammatory eye is gradual loss of the vision. Proton the eye loss of transparency leading the total blindness. Animal source of vitamin C include fat, liver, oil, beef, fish, milk, other dietary products. Recommended intake: microgram mg/kg. International unit IA. IU. Food package usually command IU. Diet contains 900 mg REA vitamin. This recommended intake the male over 14 days very rare. And supplement the tables helps the professional to will help in the understand the message. Vitamin D synthesis in the body the adequate amount of exposure sunlight. Exposure to sunlight or in diet through the protein food supplement as body amount making the food also the prakasha when the ultraviolet light meet the skin. Deficiency of vitamin D lead to decreased absorption calcium in muscular tenderly children. Arthromelica in adult. Chlorrepresented teeth and malformed digly bone teeth. Adult quality of the bone reduced. Escapably low calcium level. Bone and limb pain, demineralization of the bone, pain on lower back and leg, frequent the bone fitted. Vitamin D. Requirement of source butter and milk, paint and capacity. Recommended to exposure sunlight at least 5 minutes. Deficiency recommended 4,000 microgram day. Type of vitamin D is not signal substance but a group of compound collective of calciferol, bloodstream and the converted calcitorial. Vitamin D3 found in animal fat. Vitamin D2 found in plant such as mushroom. Vitamin D recruitment reproduction, primary antioxidant better oxidation enzyme maintenance of regular of the member. RPC hemolysis, platelet agreement. Iron metabolic maintenance immune system prevent accumulation lipid produce. Deficiency, uncoordinated movement, weakness, sensor dispersion, cases of hemolytic anemia in infant. Function of retina leading to permanent blindness in infant. Reproduction failure. Requirement for food source, vegetable oil, sunflower seed, egg, almond, sunflower and oil, butter, grain, mustard oil and good storage. Requirement linked to essential fatty acid. Requirement 0.8 mg essential fatty acid. Vitamin K and glycemic factor. Essential acid promotion to release thromboplastin and catalysis from prothrombin. Source of dark green and dietary meat product sheet. Vitamin K supplement not recommended because chances to lower intensive colonic bacteria. Deficient area of infantry result in delayed blood clotting. Hemorrhagic deficiency does not occur to adult. Minerals, inorganic substances are classified as micronutrient based on the amount of needed the human diet. The essential micronutrients calcium, sodium, phosphorus, magnesium, sulfur, potassium, chloride. Important microminerals are iron, zinc, copper, cobalt, fluoride, magnesium, chromium, iodine, and molybdenum. Minerals function of source. Sodium requirement fluid balance nerve transmission muscle contract. Ca requirement fluid balance tablet slide production milk and soya source. K proper fluid nerve transmission muscle contract food grain ligament milk fruit vegetables are common source. Calcium recommended healthy bones and it is immune system health, nerve function and blood pressure regulation, bone formation and proper calcium for any bone. Essential contract with your heart, skeletal muscles. Calcium, activation, magnesium, renin, and the pancreatic lipase. Vitamin deficiency, titan core when calcium in blood drops below critical level. Phosphorus has a balance with healthy bone, essential for storage and release ATP. Important role in the buffer phosphate and major compound of cell membranes. Intracellular organ, part of DNA, RNA. 20-30% calcium phosphorus are facilitated by vitamin D. Calcium and potassium recommend adult 400. Pregnant woman 1000. Children 50 years 40 and 16 mg. Osteoporosis is a condition found in primary among middle-aged and elderly women for aspiration and utilization. Milk and milk products Bengal some milk or some source of the calcium potassium. Mechanism is needed of making the protein muscle contraction. Nut and seed ligament green vegetable are some source. Sulfur present in the protein molecule, egg, meat, milk and ligament, nude and storage. Micro minerals also the track element. Iron, total body iron 4 mg adult aceto complex M body present iron properin compound hemoglobin in RPC, myoglobin in muscles, M-chain, peroxygen, automation, satirized cognition, transfer source of transferrin and ferritin. Food source is chemo, iron, and utilized better. Animal tissue and non-chemical plant food. Iron function, iron part of the protein from the part of myoglobin, catalyst vitamin J, carotid, purine and collagen, deoxyribonucleic acid liver, lead to nutritional anemia occurs. Nutritional anemia deficient structure, function, and epithelial tissue. The inside the lower cerebral pulp pinky. The respiratory change of clearly the cardiac failure. Symptoms palpitatum time vision, subsequent infection. Fingernails become the flat evenly spoon shaped colonoscopia. Vitamin B complex. Water soluble and vitamin B complex. Water soluble vitamin long fatty vitamins does not store in the body. Does not eliminate through the urine. Water the nature replacement frequency. There are no influences in water soluble vitamins. Important of water soluble vitamins B, C, and B complex include B1 thiamine, B2 riboflavin, pantothenic acid, and B6 pyridoxine, B7 biotin, B6, B9 folic acid, B12 cobalamin. Organizing B group vitamins were grouped together because found there is a vitamin B complex. 1920 proof of the extent is more than the vitamin B salt. Now the vitamin B complex. Folic acid discovered by cobalamin, vitamin B12 discovered in 1948. Thiamine B1. Source meat, leaf vegetable, grains, nuts, fish, white grain, and legumes. A functional essential for the metabolic carbohydrate reaction, effort deficiency of down loss of the protein table. Property extremely water soluble, very intensively heat, discovery intensively heat, and observation greater raw seafood content thiamine, which play the thiamine to the known it RDAS. The heat in the fish disturbed is enzyme. Vitamin B complex 2 riboflavin. Source milk production is salmon, protein with green leaf vegetable, sorghum melon, tomato, bore phosphate. Function of growth necessitated health skin and coenzyme necessitated by health nerve. Effects of deficiency during the class 2 days. The liquid mainly coronary cirrhosis. Return of growth skin abnormality include the clearly dermatitis, eye disorder, anemia disease. Property orange yellow, substance water soluble normal cooking temperature. High temperature is pressure to cook, unstable cooking with a bright soda. Ultraviolet. The picture is diamond P1 deficiency beriberi, which is a nerve impulse in transmission evidence present. Riboflavin B12 deficiency, vitamin B deficiency, class 2 donkey, cellulose, eating burning by eyes. Glutonic acid and anti-biliary vitamin. Source meat, red fish, bread, fish, bread, wheat of grain, a functional necessary to help to release energy from food. OM necessary for healthy skin. Bell agra reduces skin exposed to the sunlight, which making the dark and gross. Italian word bell agra painful of skin. Dispersion, weakness and weight of loss. Properties water soluble, stability to heat, 80% loss in the millennial crowd. Loss of during the RDAS, no nitrogen lane. Peroxide species. Source fish, salmon, meat, egg, liver, sweet potatoes, milk, fruit other than bananas. Function of coenzyme protein helping release the energy protein. Weaken effects and deficiency. Insomnia, weaken nails and hair and skin problem. Anemia, macrocytic. Water-soluble properties are fairly stable, may be loss of in through effective acquisition. Folic acid. Folic acid will be brought down vitamin present in the food. Folic acid supplement will be vegetable and portable breakfast cereal. Source liver, green leaf vegetable, titled beans, orange and wheat produced cauliflower. Function necessary for DNA, RNA, genetic material, cells and growth, B12, iron make in a red blood cell. Folic acid through the help in reduce attack to stroke and cancer function. They necessary to the help the neural to early stage fetal development. First deficiency. Microcardial anemia, blood cells are reduced in number, large in size, and they carry large hemoglobin. Low level of folic acid will include with atherosclerosis, contributed arthropods, and infertility. Properties actually during the cooking, water shall be bread soda, alkaline, increased loss of folic acid added to cooking the water. The children to 12 years 200 milligram, adult to 300 milligram, pregnant lactose 400 milligram. Cobalamin to B12, cobalamin is substance of complex structure of all vitamins. Cobalt atom the present in the molecule. Source cobalamin is found in a small amount of the animal tissue but absent from the food, plant, organ, egg, milk, cheese, meat, fish, aquatic. Cobalamin converted motor tryptomycin function play part in the nucleic acid during the cell division, help in the presume anemia, necessary help to the formation of myelin, fills the nerve fiber. FSR deficiency reduce the number of blood cells including supplemental infection. Mental confusion, memory loss, moodiness. Properties water soluble sensitivity to light, preserve strong acid and alkali. Its stability to 200. Added to children 0.7 to 1.0, dinner 1.24, adult 1.4, pregnant lactate, mother in 1.2. Vitamin C, aspartic acid, name vitamin C, aspartic acid. Vitamin C is most unstable. All vitamins are soluble in regulated sublimated. Source citrus fruit, orange, strawberry, and pineapple fruit piece. Function naturally food in manufacture connect to tissue. Strong bone and stitch. Strong blood vessels. Prevent the absorption iron. Necessary for cell metabolism. Deficiency. Iron deficiency, anemia, little weakness, stabilized infection. Dilute heal in the fondant. Bleed in the gum, last stage, paint lymph nutrient. Properties. Crystalline substitution water in soluble. Act on the anti-arterization, unstable to the heat. Oxygen air reserved, alkaline freezing symptom. Niacin deficiency bellegram. Vitamin C, vitamin C form other vitamin C number of tissue characters. Vitamin C actual compound related simple organic acid, structural similar carbon sugar. Only for animal speak vitamin C. Vitamin C is one of the most unstable all vitamins directly distributed process of cooking during the overcome. The good dietary source vitamin C created a fruit and green vegetable. Humans need more vitamins than other vitamins. At almost at temping the simple during the serum level water soluble vitamins this reflected only presently circulation vitamin level cannot observe strong level. Alternative method testing immunoassay chromatographic method, chemical method, high performance liquid chromatography, capillary electrophoresis depend on the vitamin begin tested. B2 cobalamin folate acid discharged below the essential option to complete blood cell count. MCV chemodiuretic and hemoglobin in additional methylmalonic acid and the homocysteine level. track element inorganic micronutrient. Organic nutrient typically less 0.1% by weight. Circular physiology and metabolic function. The iron, zinc, helium, iodine that catalyze enzyme acquisition, transfer, and the growth. Will deficiency or excessive some mutation lead to the survival health. NIH other major organizations and the symbols track minerals, microorganisms. Iron 8.0 mg, copper 1.29 mg, zinc 8% 12 mg, iodine 150 200 micro mg, helium 55 200 micro mg. Key essential for drug development iron critical acquisition transfer hemoglobin formation and metabolism. Zinc vital luminous function and synthesis of blood. Iodine chromatin regulation of growth and development. Helium production cell damage. Copper nerve function connected to the formation. Mechanism amino acid cholesterol carbonate metabolism. Chromium insulin acquisition and metabolism. Molybdenum function of cofactor enzyme break down the amino acid. Fluoride essential for maintenance of dental health and bone strength. Classification to document of physiological function, reaching chromic and mechanism helium. Properly processed essential for such a role proton cobalt silicon. Non-essential toxic low level mercury lead cadmium arsenic. Health toxic deficiency of illness anemia iron deficiency greater iodine deficiency. Toxicity toxic content high except low over time. Very small some element such as helium. Environmental source track element occur usually water, environment, food and can naturally for pollution. Calorific follow food. The calorific food is the total heat energy released to metabolism, measurement calorific and kilojoule. The body of dietary apple measures KCl, carbohydrate, protein and 9 KCl. Determine the energy release of the food is the calorific value of food. Physiological calorific value of typically nutrient, carbohydrate, protein, fat type macronutrient in the larger quantity. The dry weight of the diet and 100% energy. All three provide energy measurement, but the amount of energy 1 gram, 1 bar 28 ones for different. 4 calories gram on carbohydrate protein, 9 calories in gram on fat. This nutrient are different high quality supply energy carbohydrate low level. Carbohydrate into sour, protein into amino acid, fat into fatty acid like the body uses bulk substance of need to growth, maintenance and activity include the other carbohydrate, protein, fat. A daily recommended calories, carbohydrate, fat, protein vary by the age of weight of the patient. The biochemistry basal metabolic rate RQ and STH explained. The basic metabolic BMR quantity energy expended rate for the viral infection. Respiratory quantity RQ level body burning. A quick dynamic action STA compound the energy in food, the digestion and metabolism. Together the individual power over the metabolic health in the energy dynamic. The table column biochemistry basal metabolic rate BMR, RQ and STA. The metabolic BMR definition of energy equilibrium rate and the functional BMR three type of maintenance of body function, supporting organ function, regulating body temperature. Another one normal BMR value significant evaluation based age indicator metabolism health relevant. Another factor is activity BMR age body composition, genetic hormones, physical colonic and climate illness. The respiratory quantity QRQ definition carbon dioxide produced acquisition consumption application of RQ assimilated metabolic food life monitoring division specific dynamic action STA definitely increase in metabolism rate at 100 STA calculated method of contributed director calculated into eliminated debt. The table column important. Basal metabolic BMR definitely minimum amount of recommended body maintains vital function, breathing, circulation, temperature regulation, total physical day. Measurement taken post observation 2.12 hours thermometer environmental factor, children's muscles mass decrease age. Significant account of 16 to 70% of total dietary explainment. Specific dynamic action STA the thermic effect of food TEF. The metabolic energy explained by PMR occurs during the digestion, absorption, and accumulation of food. Value 10% of total energy requirement. Food type of protein we have highest STA. TF present about 10% caloric intake healthy adult standard micronutrient diet. The 9 calorie per gram it is a 0 percentage. Carbohydrate 4 calorie gram and TF 5 percentage. Protein provided 4 calorie gram TF 20 to 30 percentage. Research of metabolic BMR amount energy body to another way it is how calorie body would live in the town all day. DEF related the measurement it refers the consumption accountant of 10% daily energy expenditure and noted above. Respiration quantity RQ. Respiration quantity is the rate of the producer constituted typically present carbohydrate 0.7 for the fat 8 to 9 protein at metabolic assignment. Definition rate of volume of carbon dioxide volume. Carbohydrate, fat, protein, and significance of calculated nutrient contribution and used to the metabolic card studied fitness testing. Diet higher intake the lower RQ, higher carbohydrate intake the ratio. Metabolic disorder condition, diabetic acidosis can change RQ value. Exercise intensive increase the carbon dioxide the non-respiratory means potential making the measurement value often the respiratory. Balanced diet. Balanced diet is the one contains a different mineral, protein, calories, other nutrients to meet. The common balance will differ different according to age, sex, physical activity, economical status, physiology status, pregnancy and lactation. The additional balance will provide a compound of dietary fiber, antioxidant, nutrient, which pass through the health the benefit. The balance should be approximately 60-70 total calorie carbohydrate, 10-50% of protein, 20-25% of fat. Recommended diet allowance RDF nutrient present in the diet the satisfies daily requirement the involved population nationally 97%. Auto recommends of factor nutrient influence in the sex and body weight. Dietary intake nutrient recommended different population group. Aduke intake the recommendation the observation experimental determined exams group of health people the significant scientific evidence. They calculate the recommended dietary allowance RDA. The mean plan in the male should meet the general the specific interval requirement. The food permanent decision may attack the health eating picture. The health involved in the observation, animal source and oil, vegetable fruit, other than illumination would be diet. The way to food of source of the balanced healthy diet. The principle of the planning diet and meal planning food made to nutrient document calories, fat, protein, also they include assignment minerals, vitamins necessary for physical well-being in the family members. So energy distributed carbohydrate protein 7.5 include the food per group. Meals pattern to fulfill family need. Meals are different family members. Children will ability caloric density meets the energy need. Meals should have the time of energy. That's simple nutrient. The labor and having the division food, convention food also it is the time of the energy. The meals balance should need a satisfied family budget. The course meals will decrease the bulk by using the seasonal and fruit and vegetables. 3000 calorie and length muscles. Meals of food maximum nutrient. Lots of the nutrients food in produce food ensures the nutrient value. Pressure cooker used to the consideration nutrient. Concentration into water only accurate diet like. Meals would only recommended dietary allowance concentration in water prepared. The meal balance the food probability. Monotonous and meals and becomes the intelligent different food of the scholars cooking the method. How to prepare the balanced diet chart? A personal and diet chart are considered following step. Consider the age, weight, and activity level, and medical contribution include the food and alcohol. Protein control, consume appropriate quantity of a group. Adjust to the large muscle can health condition check on the frequency of intake the daily. Consolation balance. Relative nutrient density of protein during one longer health up. The remember health mental will in the overall quality life. The great and balance in the meals plant incorporation nutrient is the anyone lead a healthier more vibrant life. Maramasu and Kachuvaras, Maramasu server deficiency malnutrient, micronutrient into extremely muscle wasting and key village separated. The Maramasu result on the survey of overall the caloric deficiencies were Kachuvar actual protein deficiency. The presence was in the skin over bone. Kachuvar present in the belly and fat extremely due to edema. Abducted edema children very concurrent to Kachuvar frequency of support ability anthorexia. After the Quranic development slowly, where was Kachuvar and rabbit concept. The treatment and management treatment of medical additional imbalance management hydrogen and infection, slow introduction production and formulation, vitamin mineral supplement HLV management one thing, improve promoting pregnancy, sanctuary achievement product like fold.